citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. The board not entertain comments or discuss or negotiate claims at this meeting. The other announcement is I want to note that some of our members are appearing and you can see we are seated to accommodate state and federal recommendations regarding social distancing related to the current public health emergency. We're also continuing to streamline our meeting process to avoid non-essential items for our consideration. So with that, we start our meeting approvals of the day. I see the approvals of the day. That's right. So move.
Second.
All those in favor respond by saying yes.
Yes.
Those no. Thank you. The motion is carried. Secondly, I'm seeking approval of minutes of the board meeting of June 15th. All those in favor respond by saying yes.
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 Carries. Board reports. Our first one is, let's see, there are no board reports. Then we'd go to item Roman numeral 5, reports of the medical staff. Dr. Schulman, Chief of Staff, please.
Yes, we have 3 motions for medical staff. I believe Sharon Wetzler has the reports. Here?
Yeah. Would you like to read the reports, Dr.?
Yes, please. Thank you.
Recommendation to approve Sarasota call schedule policy. Recommendation to approve critical care medicine privileging form. And recommendation to approve TAVR, cardiology special privileging. And I move approval of Sarasota Memorial Hospital emergency room call schedule policy, the critical care medicine privileging form, and the TAVR cardiology special privileging form. All is recommended by the medical executive committee.
Second, the TAVR.
All in favor respond by saying yes.
Yes.
Any opposed, say no. Your motions are carried. Thank you, Sharon. Thank you, Doctor. Next on the agenda is our secretary's report. Britt Reiner, please, Britt.
Yes, so we meet next Monday, August 17th, 2020, from 9 to 10:30 is the Mission and Planning Committee, from 10:30 to noon, the Finance Committee, from noon to 12:30 is the closed session of the Hospital Board, from 12:30 to 2 is the Board Lunch and Issue and Financial Review, and from 2 to 4 is the board meeting. We will also be meeting on Wednesday, September 9, 2020, at 5:01 p.m. for the preliminary
A
budget and
participant
millage
has
hearing.
joined the meeting.
Thank you.
Thank you, Britt. Treasurer's report, Joseph J. DiVirgilio Jr., Treasurer, seeking approval of bad debts and charity.
I think you guys can hear me. I have a motion. I move approval of bad debt and charity care for the month ending June 30th, 2020. The amount $24,826,000.
May I have a second, please?
Second.
All those in favor respond by saying yes.
Yes.
Any opposed? Motion carries. Thank you, Joe. Next up is our Chief Financial Officer with the financial highlights. Bill?
Thank you, Mr. Chairman. I have the financial highlights for June. And just remind everyone that We've now completed 9 months of our fiscal year, third quarter. So the fiscal year to date numbers represent 9 months of activity. It's total revenue in the rating agency format for the system. For the month of June, we had revenue of $90,059,000 compared to a budget of $84,322,000. Fiscal year to date, revenue of $766,636,000 compared to a budget of $792,740,000. Total expenses for the system for the month of June, $76,610,000 compared to a budget of $78,093,000. Through 9 months of the fiscal year, total expenses of $705,556,000 compared to a budget of $733,802,000. Operating income in the ratings agency format system for June, $13,449,000, which generated an operating margin of 14.9%. Compared to a budget of $6,229,000, we budgeted for an operating margin in June of 7.4%. Through the first 9 months of the fiscal year, we have operating income of $61,080,000, which is an operating margin of 8%. $8,938,000. We budgeted through 9 months for an operating margin of 7.4%. Looking at statistics for the hospital, average daily occupancy, and these are all June year-to-date numbers. Average daily occupancy of 586 patients per day, compared to 575 in the budget. The average acute length of stay so far this fiscal year, 4.43 days, compared to the prior year's 4.32 days. Admissions through 9 months, 31,705, compared to a budget of 32,608. Continuing statistics, surgery cases, 17,505, compared to a budget of 19,611. And again, through 9 months of activity, births total 2,881, compared to a budget of 2,865. Outpatient registrations through 9 months, 319,817, compared to a budget of 366,516. And in our 2 emergency care centers, we've had total registrations of 84,347, compared to a budget of 92,940. And our case mix index through 9 months for all patients is at 1.84, and for Medicare patients, 1.96. Mr. Chairman, that concludes my presentation, unless there's any questions.
Thank you, Bill. We now turn to committee reports.
Chaplain
Audit
John
Committee,
Gerhardt
Trent Hudson, please.
has left the meeting.
Trent?
Can you hear me?
Now we can, Trent. Thank you.
All right, thank you. Thank you, Mr. Chairman. The Audit Committee met this morning, July the 20th. The minutes of the Audit Committee meeting on January the 28th, 2020 were approved. The board's current Audit Committee bylaws were reviewed. We specifically discussed the responsibilities of the committee in terms of the hiring and coordination of the KPMG external audit. We talked about the responsibilities to investigate as appropriate potential or actual improprieties in financial operations in consultation with the Corporate Compliance Officer, the Internal Audit Director, and General Counsel. We also talked about the importance of obtaining the advice of outside consultants and professionals on matters within the scope of its responsibilities. Our third agenda item was a presentation by the auditors from KPMG, Todd Webster and Julia Safina, presented the 2020 financial plan for auditing the Sarasota County Public Hospital District. They reviewed their risk assessment, their planned deliverables and timeline, their independence, and also their fees for the audit. The last item that was discussed was the Doctor's Garden matter. At the June 15th board meeting, it was revealed that the management of the hospital district caused Doctor's Garden Association to donate, under the guise of a charitable contribution, $50,000 to a newly created political action committee. The chair of the audit committee questioned the propriety of such a contribution in light of the pandemic and the district furloughing and flex timing employees. The board chairman referred the matter to the audit committee chair to conduct a preliminary review and report back at the July 20th meeting. In discussions with management, the CEO assigned Mark Thornton, Director of Audit Services, to work with him in reviewing the matter. In the course of the review, it was discovered that there was an additional effort on May the 28th to transfer the balance of the funds in the Doctor's Gardens account upon the dissolution of the association to the Political Action Committee. At the end of May, the balance in the account was $292,000 and some change. It should be noted that during the review period, the PAC returned the $50,000 to Doctor's Garden, and the CEO, after revelation on June 15th, halted any transfer of funds from Doctor's Garden to the PAC. A motion was made that the board engage an independent counsel whose firm is knowledgeable in public funds, government entities, election law, condominium law, and financial matters to review the facts surrounding these matters, make a report to the board, and render an opinion on the propriety and the legality of such matters. The motion, upon a roll call vote, failed 8-1. Voting in the affirmative was Mr. Hudson. Voting nay, Mr. Meister, Dr. Raymeyer, Mr. Carter, Mr. DiVirgilio, Mr. Peters, Ms. Lodge, Ms. Reiner, and Mr. Henry. That concludes my report.
Thank you, Tran. We now turn to the Finance Committee. Joe DiVirgilio. Joe, please.
Yes, thank you. This morning, one agenda item to deal with the preliminary tax millage rate for fiscal year 2021. Bill Logan, CFO, presented information to the committee for such tax millage rate. He outlined the system plan for fiscal year 2021 and beyond.
Nobody offered a reconsideration.
And he also reviewed the cost pressures impacting the system. The value of Sarasota, including the value of new construction, has increased 5.5% over the past year. Management's recommendations is to set the fiscal year 2021 preliminary millage rate at the current millage rate. The board discussed the information provided. As a result of that, based on the information and discussion of the Finance Committee, I move approval of the recommendation of the committee to set forth the fiscal year 2021 preliminary millage rate at 1.0420, which is the same as the current millage rate, and to set the first public hearing to adopt the proposed budget and millage rate for September 9, 2020 at 5:01 p.m. and the second public hearing to adopt the budget and millage rate for September 21st, 2020 at 5:01 p.m. Both hearings are currently scheduled to be held at the board auditorium on the first floor of the Sarasota.
Those we have a second motion. All those in favor, please respond by saying yes. Vote. The yeses have it. Thank you. We now turn to Audit Committee. Sharon Wetzler.
Yes, the board continues to oversee and receive information on various programs and committees, working to ensure that the care of our hospital patients' lives lives up to the Sarasota Memorial standards of quality and safety. However, because the Quality Committee of the board meets in closed session, I have no reports.
Thank you, Sharon. We now turn to our President's report, the Director, President, and Chief Executive Officer, David.
Thank you, Mr. Chair. I'm going to start as I do every month in looking at our organizational report card. The first item, we look at all 5 of the areas that we concentrate on in the organization. First would be a net of service. Our indicator there is our system patient experience, our likelihood of recommending the number of service areas greater than or equal to the 75th percentile. We have a goal of meeting that 8 out of 10 in 8 out of 10 areas. Happy to report we are exceeding that and hitting that in 9 out of 10, and I will show you the detail on that in a minute. On the people section, we have our goal of having our turnover of part-time and full-time staff that have been hired within the last 12 months of being 23% turnover or below. I will tell you, we are missing this goal just a bit right now at 24.5%. We have had a lot of oddness going on with staff due to COVID issues, and we think that that's a blip and that will self-correct itself maybe as early as next month. So more to follow up on there. In the quality area, we did have a quality committee this afternoon or this morning and looked at a lot of very detailed things, but we look at one item for the board report, which is our infection prevention or our combined overall standardized infection rate. We have a goal of being below 0.9. Happy to report we are exceeding that in a good way at 0.73. Just to remind the board and the public that the 1.0 would be a national benchmark or the expected number. We already set our goal to be somewhat quite a bit lower than that. We're even exceeding that. So, in the finance section, our CFO just gave our report, Bill Wojin. Our goal there is having our operating margin be at 6.5% or higher. Happy to report that we're projecting our operating margin for the end of the year to be at 8.8%. In the growth section, we have 2 goals. The first being our inpatient admissions and outpatient observations of 50,047 patients a year. We are projecting that we're going to come in short of that at 49,146. In outpatient registrations, our goal will be 930,630. We're projecting in short of that as well at 856,221. Both of those numbers dramatically affected by the COVID numbers. Next page gives us a little bit more detail to our patient experience report card. It shows you our likelihood of recommending in the 10 different areas that we survey. The next column over is our year-to-date score. The next column, or the first green column, is the national median score. And then finally, what we compare ourselves to, which is the 75th percentile score. So I'm happy to report that in 9 out of 10 of our areas, we are exceeding the 75th percentile. The one that's being a little bit missed is the emergency care center at Northport, which is one point under. We have 87 versus 88. And then, of course, we're exceeding everything in the national median score. Okay. Next, I'd like to talk about SMH is the first in Florida to offer experimental treatments for COVID-19. Sarasota Memorial has joined a multinational trial that is testing a new dual-action antibody treatment designed to reduce the severity and potentially stop the spread of COVID-19. This is being led by Dr. Manuel Cordillo, our medical director, Sarasota Memorial's infection prevention and control and principal investigator for the Sarasota trial. SMH is the first hospital in Florida to administer the experimental treatment to COVID patients who meet the study criteria. The trial is initially open to hospitalized patients, but could be expanded to non-hospitalized patients with milder symptoms. And we just want to continue to thank Dr. Gordillo for everything he continues to do leading through this crisis. Next up was SMH was named among the top 100 hospitals by Watson Health. Sarasota Memorial Healthcare System was recently honored as one of the nation's top 100 hospitals by IBM Watson Health. SMH was chosen from 3,134 hospitals across the country for outperforming peers on all performance benchmarks, including inpatient mortality and complications, healthcare associated infections, readmission rates, length of stay, cost of care, patient satisfaction. This is the 5th time SMH has been named among the top 100 hospitals by IBM Watson. SMH leaders urge community to wear a face mask. As the number of COVID-19 cases continues to rise, SMH leaders launched a campaign urging community members to help prevent the spread of the infection. We encourage our elderly to continue staying at home and applaud the extra precautions by caregivers and others to keep them safe. We urge public officials to require cloth masks to be worn in public places such as grocery stores, public transportation, and public buildings. We ask people of all ages to limit their social circles, follow physical distancing guidelines, and for everyone's sake, please wear a mask when you're in public spaces. SMH also shares the importance of the 2020 census that's ongoing right now. Local participation in the census helps SMH better predict how our population and demographics will change in the future and how the changes will impact the community's future healthcare needs. Census counts help SMH plan facilities and services for decades to come. And we encourage all residents to visit U.S. Census Bureau's my2020census.gov page and complete the census online. Our internal medicine residents are recognized. Congratulations to our first graduating class of SMH/Florida State University Internal Medicine Residency Program. Graduates were recognized on June 19th. Several class members will continue to practice in our community, with 2 joining our hospice and palliative care fellowship program. So congratulations to our inaugural class for completing a lot of hard work. You know, usually at board meetings, we bring in a number of people who are recognized for being the Excel employee of the month, or the leader of the quarter, or the physician leader of the quarter. Obviously, we've had to change up what we're doing a little bit. So I want to share with you exactly how we've recognized these fine individuals. So congratulations to Sarasota Memorial's 2020 service anniversary honorees. We were unable to hold an in-person celebration this year, so instead recognized our staff for special video, in a special video featuring those who marked our 5, 10, 15, 20, 25, 30, 35, and 40 years at SMH. Kudos to all of the 2020 honorees and their incredible dedication and service. We had 2 40-year honorees this year. Mike Myers in Respiratory Care Services, and Tweed Patton in FPG Information Services. So congratulations to them. I jumped ahead in my story there. I was talking about the Excel stuff and I got to slide off, but now I'm going to talk about that. SMH celebrates our staff achievements. We also did videos around these folks to recognize them. Congratulations to our most recent Employee and Physician Award winners. Our award for April 2020 is Philip Jones, Health Fit Personal Trainer. Our Excel Award winner for July 2020 is Demetrius Willie, an MST for Orthopedics. in our Excel physician of the quarter is Dr. Mark Navarro in our SMH Urgent Care Centers. Congratulations to all of these. These videos are on our YouTube channel, and I would just encourage everyone to go and take a look if you haven't already. Construction progress, SMH Venice, recent glass installation at the new hospital on Pine Brook and Laurel Road, target to open fall of 2021. And if you can definitely see the glass from the interstate now and see this building going up. We're very proud of it. I appreciate all your hard work that's happened. So construction progress on our Radiation Oncology Center. Our new state-of-the-art facility on University is now complete and will be open for patient care on August 3rd. We think this is a new standard in this radiation oncology care for our community, and we look forward to having the community take a look at that and see the incredible progress. And Lori, appreciate you and your team for making this dream a reality. In addition to the Radiation Oncology Center, we also have our Oncology Tower that's going up. These are two pictures that just give you a little different angle of where we are. The one who's driven on Highway 41 in front of the hospital would also see the incredible progress going on. And we're still open for, scheduled to open in fall 2021. And we're looking forward to a celebration around that. And finally, I just want to thank the community for standing beside us during this tragedy or this disease that we're all experiencing. We are doing well in it. We are certainly learning every day and look forward to continuing to serve this community. We do just want to continue to pass on our message of please wear your mask when you're in a public area and practice social distancing. Thank you. That's my report.
Thank you, David. Consent agenda, as I understand, there's nothing to report. Public comments, members of the public wishing to make a comment to the board were provided an email box address that was open from noon yesterday until today. Karen, were there any emails to that box, and has anyone signed up to speak?
No, sir.
Thank you, Karen. Legal matters, Carol Ann?
No report.
Other business? Having completed our agenda, we stand adjourned. Thank you.